Well, I guess we'll go ahead and get started. Thanks for coming in and participating in our health fair today. We really appreciate it. My name is Tracie Stratton, and I'm actually the Chief Nursing Officer here at the hospital. Today what I wanted to do is just talk a little bit about my journey through breast cancer. I'm a 3-year breast cancer survivor. And when you are diagnosed with breast cancer at such a young age, I was 5 days away from my 41st birthday when I was diagnosed. It really has a significant impact on your life and what you think and maybe how you take care of your health, I think, afterwards. And being in the healthcare industry, I've always been a firm believer on self breast examinations and early mammography and all of those things. And I can tell you, I never thought at the age that I was diagnosed that all of that would be real to me. And it was. So I just kind of wanted to go through a little bit about my journey, talk to you guys a little bit about why I made some of the decisions that I made, the information that I had in front of me, and kind of how I transversed through that process of being a cancer patient and now on the backside being a cancer survivor. So I know that there's been lots of talks about cancer today. I don't know how many of you heard any of those previous talks, and I don't know if they shared any statistics with you guys, but 1 in 8 women will be diagnosed with breast cancer at some point in time in their life. And that's a pretty staggering number. I mean, that's a lot. And I was one of those 8. In 2013, there were 232,340 women who were diagnosed, and 39,620 lost their lives due to breast cancer. Interestingly enough, though, only 5 to 10% of the women who are diagnosed with breast cancer have some sort of genetic link associated with their particular cancer, which really surprised me, because the information that I had always heard or had kind of always assumed was that women who got breast cancer, it was because there was some sort of genetic link that made them highly susceptible to breast cancer. But when you look at only 5 to 10% are linked to any sort of genetic component, that's a pretty low number. So a lot of people who end up having breast cancer really don't have any genetic ties to them whatsoever. My story was a little bit different in the fact that I was adopted, so I had no idea what my genetic background might be composed of, which I will tell you put a very much a more complicated component into the decision making of how I was going to treat my specific breast cancer, not knowing what my genetic background or what my familial history was going to be. So I had to rely on tests, and I just had to rely on a lot of gut feeling as far as what I felt was good for me in my cancer treatment. So my journey began back in July of 2011. I had, like I said before, had been a huge proponent of self-breast examinations. I had done them, not as regularly as the recommendations say, but I would probably say I was averaging maybe an exam, self-breast exam, every maybe 2 to 3 months. Sometimes maybe I went as long as 4 months, but I was at least doing it a couple times a year. I had my first mammogram before the age of 40. I did a baseline at the age of 38, and that was something that my physician had recommended. I didn't go into my physician going, I want my first mammogram. I had gone in for my yearly exam, and we were talking, and she said, I would highly recommend you get your baseline mammogram before the age of 40. That way, if something was to happen, we would have something to go off of. And I was like, okay, well that makes sense, so why not? So I did that, had it at 38, and then had a mammogram, of course, at the age of 40. And so by the time this event in my life in 2011 occurred, it had not been quite a full year since I'd had a mammogram. So I want you to kind of keep that into perspective a little bit, because I think as I go through my story, it'll show you how quickly these things come upon you and how quickly they can spiral out of control. Hence why you shouldn't rely on just yearly mammography. The self-breast examinations play such a huge role in that. Unfortunately, or fortunately, depending on how you want to look at it, I was on vacation when I found my lump. And interestingly enough, I was in Jamaica. I was in my hotel room, I was putting sunscreen on, I was getting ready to head out to the beach to get some rays. I had my husband and my children with me, and something inside me just said, you know what, I'm going to stop here for a second and I'm just going to do a quick exam. I don't know why. I believe strongly that things happen for a reason. There was just something inside me that told me I needed to do that. So I took a few moments and did that, and I found my lump. And my lump was on the inner side of my right breast, fairly up high actually, not where you would think about it. So as I did that, I was like, oh, what's that? I've never felt that before. And you panic. I will tell you, I panicked. And I stopped breathing for a moment. And I thought to myself, oh dear God, what did I just find? And I apologize, I'm probably going to get emotional because this is very emotional for me. I called my husband into the bathroom and I showed him what I had found. And he looked at me and he says, oh, it'll be fine. Oh, it'll be fine. And I said, okay. And I thought to myself, I have a choice to make. I could either freak out and ruin the rest of my vacation, which we had just begun, I had just gotten there the day before, or I could pull myself together and not worry about it for right now. Go on, finish my vacation, let's have a good time with my family, and I'll take care of it when I get back. So that's what I decided to do. And I must admit, I did a pretty good job. I was pretty proud of myself to not let it worry me through the course of that week that I was there. And then I got back, and my dad, unfortunately, had some surgery while I was gone, and so when I got back, I wasn't able to take care of it. I had to go be with my dad because he needed some help. So I went and visited my dad and was there for a week. I came back. At that time, I was a CNO at another hospital, and I got busy into work because I'd missed 2 weeks of work, and I was really, really far behind. Didn't get in to get it taken care of. Finally, that third week, I actually started having pain, kind of an achiness up here. And I stopped and I thought, oh dear, I haven't gotten this taken care of. And so that scared me. So I immediately made an appointment to go in and see my gynecologist. And they were great. You make that phone call and they said, you need to come down and see us right away. My gynecologist was about 3 hours from where I lived. I didn't see a gynecologist in the town that I was living in. I'm from Wyoming, and so I went down to Fort Collins, Colorado. That's where my gynecologist was. So I took another day off work and I made the trip to go down. And they were great. They got me in, they immediately got me a mammogram, and then after the mammogram, they had me sit and wait. I sat and waited for the results, and I thought, okay, I've read up on this a little bit, and I know that a majority of these bumps and lumps that women find are not malignant. I thought, I'm going to be just fine. I could do this. This is no problem. And I sat and I waited and I waited, and the longer I waited, the more concerned I got. And I'm a healthcare worker. I mean, I know how to go through the healthcare system, and I knew that that was not a good sign. So the radiology tech comes out and gets me and says, we would like to do an ultrasound. And I thought, oh dear God, okay, this is not really going in the direction that I want it to go, but okay, let's do this. So we went and got the ultrasound. And then I sat and I waited some more, and I waited some more, and I waited some more. And I knew the longer I waited, probably the worse it was. And I had a very nice female radiologist who came in, and she got me and she took me back to a room. And she showed me what they had found. And I had some other lumps and bumps that were fine. They were just water-filled cysts. And she said, they'll probably, not cause you any problems. She said, but this one, right up here, has got some finger-like projections. She said, I don't like the way it looks. She said, I think we need to biopsy it. I think we need to take a deeper look. So I said, okay. And a week later, I was back in that same facility getting a biopsy. And that was fairly simple, fairly easy. They just did it under local with ultrasound. I didn't have to have major surgery or anything like that. And then I had to wait for the results of that ultrasound report. Well, I'm a busy mom, and I have kids who are very busy, and we were in Park City, Utah for a soccer tournament, and it was a Friday afternoon at 3 o'clock when my phone rang, and it was my gynecologist on the phone saying, I've got the results back of your biopsy. And I hate to tell you this over the phone. I want you to come in and see me in my office. And I said, no, tell me. I want to know. I'm not going to go over the entire weekend waiting to know what my biopsy results are. I want you to tell me now. And she says, I'm sorry to say that you've got invasive ductal carcinoma. And I said, okay. And at that moment in time, your life just completely changes. And you start thinking about what in the world and how am I going to manage through this. But I was at a soccer tournament. My son was playing, my husband was coaching, and again, there was no time for me to sit back and have a pity party for myself. I had to pull myself together, and I had to maintain my composure in front of friends, soccer team, lots of audiences that I was around, and I had to pretend like nothing had ever happened. And I did. I made it through that weekend and did just that. I had a moment of self-pity in the bathroom that night after my son went to bed, and I sat in the bathroom on the toilet, and I cried and I cried and I cried. My husband was in there with me, and I said, gosh, what if I die? What if I can't work anymore? All of those things that you either can't imagine or can't imagine go through your mind, went through my mind at that moment in time. And he was really good with me. He just let me kind of go through what I needed to go through. And kind of got that all out of my system and went to bed and got up the next morning and life went on. Because that's what life does, life goes on. I could have sat and I could have curled myself up into a ball, and I could have felt sorry for myself and asked a million reasons or questions. Why me? Why now? Why this? Why that? But when you're faced with something like this, I personally don't think it does much good to ask those questions because there were no answers. I think your success in getting through a diagnosis like breast cancer is how you approach it and your outlook and your attitude about it. And I decided at that moment in time that I wasn't going to allow my diagnosis of cancer to take over my life. I was going to be in charge. If I had to deal with this, it was going to be on my terms and how I wanted to do it, not on the terms that cancer was going to put in front of me. And so that was the commitment I made to myself, and that was the commitment I made to my family, and that's pretty much what I did. I did a lot of research, I did a lot of reading, being in the healthcare field. I didn't know everything there was to know about breast cancer. Breast cancer wasn't my area of specialty. I was a neurosurgical nurse. That was my area of specialty. Breast cancer was not. So I had to do what probably every other woman out there would do, every other consumer, and I had to sit down, I had to look up things on the internet, and I had to find out as much information so that I could maneuver through the system in the fashion that I wanted to maneuver through. I went and got lots and lots of opinions from gynecologists, from oncologists, from radiation oncologists, from breast surgeons, because I wanted to know what all of my options were, and I wanted to have all of that information on the plate so that I could make the most appropriate decision. As I went through all of that, I found a great breast surgeon. Her name is Barbara Schwartzberg. She's out of Rose Medical Center in Denver, Colorado, and she's actually a breast cancer survivor herself. And I went in and I had my first visit with her, and my husband and I walked away out of that appointment and we said, she's the one. She's the one that needs to treat me because she's the one that spoke more to me and I felt like was taking care of me and what all of my needs would be. And I'm not saying this is right or wrong. Some of the other surgeons that I went to said, yeah, I'll take it out. This is what the surgery's going to be. You'll come see me back in 10 days, and then, you'll follow up with your oncologist. She took so much more time and talked to me about so many other things and so many other options than any of the surgeons did. She said, you know what, I'm going to cure you of this. I'm going to be the one that's going to take care of you. And you will come back, you will see me regularly, and we will go through this together as a partner. And that was amazing to me, to have a healthcare provider who would speak to me in that fashion and not just as another number or as another surgery that a surgeon could get. So I chose to go with her. I decided to go through genetic testing because I had some decisions to make. I could have a lumpectomy and go through radiation, because that's one of the treatments. Or I could have a single or double mastectomy. Now, those were the other treatments. And that's kind of a big decision to make. I don't think getting a mastectomy is something that you should take lightly, because there's lots of complications that can come from mastectomies. There's lots of recovery. There's lots of pain. There's lots of different things that come with that. So I felt like this was not a decision I should take lightly. So I did genetic testing. And there are 2 genes out there that they know of right now that are associated with breast cancer, BRCA1 or BRCA1 or BRCA2. With me being adopted, not knowing what my family history was, I felt it was really important that I do that and get the results in order to help me make a decision, because I had decided in the back of my mind, if I was positive for BRCA1 or BRCA2, I was going to get a mastectomy. If I wasn't, then I was probably just going to do a lumpectomy. Fortunately enough, those results came back and they were negative. So I decided to move forward with just a lumpectomy. And the studies out there right now show that women who have breast cancer, well, there's lots of different types of breast cancer, but the breast cancer type that I had, invasive ductal carcinoma, who had a lumpectomy with radiation, your results are just as good as getting a mastectomy. And of course, I'm one for, well, less surgery, quicker recovery. To me, that sounded like the best thing. So that's what I decided to do. And I kind of decided, you know what, if I ever had a reoccurrence, then that's probably when I would go back and look at a mastectomy. But for right now, a lumpectomy. So I had the lumpectomy, and that surgery went well. And then I had the choice to make as far as what type of further treatment I was going to have. And there's lots of literature. And the one thing that I found that was really frustrating for me, and again, I'm a healthcare provider, so I understand a lot of these things better maybe than the general public, is there is no black and white answer on how to treat breast cancer. And that's what I wanted. As a consumer, I wanted somebody to tell me, do this, do this, do this, do this, do this, and this is the result that you'll get. No oncologist could ever tell me that. They're like, well, you could do this, and this might be your result, or you could do this, and this might be your result, or if you do this, this might be your result. And that drove me crazy, because I'm like, how do you make a decision? How do you know what's best? And in the back of my mind, I'm thinking, I'm young, I've got another 30 years I want to be on this earth, I've got a family to raise, and so I've got to do this right. I've got one chance. In my mind, I felt I had one chance only, and I had to do it right. And that was a lot of pressure that I probably put on myself. But in the end, my doctor, my oncologist gave me some great information, and I decided to go ahead and do chemotherapy. And the reason for that is because after I did my biopsy, they got good margins. The surgeon felt like that the area where the cancer was clean and clear. Unfortunately, I had one lymph node that had micrometastasis to it. And that scared me, because I thought, okay, if it's already gone here a little bit, where has that little bit else gone to? And I did not want to take any chances. Again, I had one chance to do this and one chance to do it right. And so I felt, with as young as I was, and knowing I had one lymph node involved, that the best thing for me to do would be to go ahead and go through chemo. And that, I will tell you, was the thing that scared me the most when I was first found out I had cancer. That night in that bathroom, I told my husband, I said, I don't want to go through chemo. I'm so afraid of chemo. You hear and see people who go through chemo and they're so sick and debilitated, and it just looks horrible. You hear horrible, horrible stories, and I thought, I don't want to go through months and months and months of chemo and be sick and not be able to take care of my family and my house and my home. And then here I was, you know, a month later, sitting in an oncology's office saying, yeah, I'm going to go ahead and do chemo. Scared me to death. But I felt like I had to, again, do what was best to give me the best outcome, you know, for a recovery. So I did, and I'm happy to say all of those horror stories that I thought or had envisioned at least didn't happen with me. I had, if there is such a good thing as having a good chemo treatment, I felt I had a good chemo treatment. If there is ever such a thing, I never had problems with nausea, never had problems with vomiting. My main issues were fatigue, shortness of breath, and if you ever hear anybody say chemo brain, it is real. Do not think that they're making that up, because it is so real, chemo brain is. I was amazed at how bad chemo brain could be, but those were probably my three biggest areas. But I knew I was going to lose my hair. I asked the oncologist, am I going to lose my hair from this, the type of chemo he's going to give me, and he said yes. I said, okay. So again, I decided I'm taking charge. I'm in charge of this, cancer is not. So I proactively drove down to Denver. I was down in Denver anyway for one of my doctor's appointments with my surgeon. And by the way, I had consulted with my surgeon as far as whether or not she felt I should go through chemo as well. And she said yes, because of the micrometastasis, because how young you are, I agree wholeheartedly with your oncologist, I would go through the chemo. So I was down there, so I went to a wig store. I got my wig, and I had the most fun at that wig store. Oh my gosh. Pulled my hair up. I didn't have real long hair, but pulled my hair up, and I tried on wigs in colors and styles that I had only dreamt of ever having. And I had the best afternoon that day in that wig store, just trying on things, looking at new, styles and looks. And I thought, I'm going to have fun with this. If I'm going to wear a wig, by George, I'm going to have fun with it. And I came out of that wig store, and I had this really long blonde wig, came down to here. I'd always wanted long, straight blonde hair. And I thought, you know what? Again, I'm going to be positive about this. I'm going to have fun with this. So I got through my first chemo and treatment, and it wasn't too bad. And I had heard that by the time you get done with your second chemo, it's probably when you're going to start losing your hair. So I decided, again, I'm going to be in control. So I went, and I proactively got my head shaved. Went down to called my beautician. She'd been my beautician for 15 years. She knew me very, very well. And we had a party. We did it at the end of the day. She brought in some wine. I had my husband there. I had my best friend there. Had a couple of other people. And we just had a party. Now, my beautician cried the whole entire time, but we had a party because I wasn't going to be one of those cancer patients that woke up some morning and had a hair full, on their pillow, or washing their hair in the shower, and you get this big wad of hair that falls out and into your hand. I wasn't going to do that. I wasn't going to put myself through that negative experience, because what I was going through was already negative enough. Why add trauma, to what I was dealing with? So that's why I proactively did that. I walked away that night, had my wig on, walked away out of the beauty salon that night, and felt great. And my husband and I, we went out to dinner and had a date, and it was so much fun because I felt good about myself, having this beautiful long blonde. Oh man, you should have seen it. It was just great. I had the best time. Went into work that Monday, because we did it on a Friday night. Went into work on Monday, and you should have seen all of my coworkers' eyes, because everybody at the hospital knew I had had cancer. But they were just like, oh my gosh, Tracie, we've never seen you. And a lot of these people that I had worked with for years and years and years, and so it was a completely different look for me. But I had fun with it. I thought, darn it, if I'm going to do this, I'm going to have fun with it. And I did. So, I got through chemo, got through radiation just fine. And I'm happy to say 3 years later, I'm standing here and I'm doing well. I don't know if many of you were here for Dr. Boquin's talk, but, did the tamoxifen thing. Cancer treatment took me through menopause. Oh, that was harsh. Harsh. When you have to go through menopause just like that, and it's not the slow, natural progression of menopause, oh, that was harsh. Hot flashes. There'd be times I'd be sitting in the hospital and I'd be stripping, because I'd have this hot flash just so intense run over me. And it was because I'd been immediately put through menopause from the chemo, that my body never had a chance to adjust, and so it was miserable. So I've been on the tamoxifen, and I just recently switched over to an aromatase inhibitor. Because the guidelines that my oncologist is telling me is usually 2 to 3 years on tamoxifen, and then another 5 to 7 years on an aromatase inhibitor. But before I could go on an aromatase inhibitor, we had to make sure that I was truly in menopause. The thought was that I would probably wake back up again and start having regular cycles after I got done with my chemo, and I never did. And he monitored my hormone levels and finally determined, I don't think you're ever going to wake up. I think you are in menopause and you will stay in menopause. So at this point in time, it seemed reasonable for me to go ahead and go on an aromatase inhibitor, which I've done. But so, it's still a journey for me. My journey's not over yet. I know that I will never be completely cured of this. Every day I always have to think about the fact that I could turn around and have cancer, either same type of cancer or another type of cancer. But you can't allow that to paralyze yourself. You just got to keep going. And I'll tell you, I worked the entire time I was on chemo. I never took, I didn't take FMLA, I didn't take any medical time off. I had my, biopsy on a Thursday, was back to work on a Monday. All my chemo treatments were on Thursday, I stayed home on a Friday, I was back to work on a Monday. Never took any time off whatsoever, because again, I was going to be in charge. And I didn't want to be sitting at home feeling sorry for myself. I felt like, if I was at work, I was still productive, I was busy, that would help me get through and maintain a really positive attitude. And I'm pretty sure we're probably out of time, but I just have to tell you this really funny story real quick, in the fact that I told you one of the side effects was that I was really tired and had shortness of breath. So I was sitting in my office at work one day and I hear code blue go overhead. Well, my practice had always been, when there was a code blue in the hospital, I would always go and attend and just, make sure there wasn't anything that I couldn't help with, or, be with the family, or, do whatever. And so I heard that, and I immediately got up and tried to run over to my inpatient unit to help with the code blue. By the time I got there, I'm all doubled over like this. I can barely breathe. And I couldn't talk because I was so short of breath, and my charge nurse, who was on the floor that day, turned around and took a look at me and went, oh dear. Took me out of the room, sat me down, put me on a pulse ox, put me on some oxygen. And she says, I can't have you doing this because I don't need to be resuscitating you either. But again, that was just my drive and my determination. I was still going to try to lead a normal life. And that's why I did what I did, because that was part of what my normal life was. And I think, having, leading a normal life, not sitting at home, being proactive with everything, I really truly feel that helped me have a really positive experience in dealing with cancer. Again, if you can have the word positive and cancer in the same sentence, I think that's how you can do that. So that's, I guess, a little bit about my journey and kind of what I experienced. And I guess at the end of the day, it's all about early detection. And I think about all of those times when I did my own self breast exams, and I think about my, early mammogram, before the age of 40, and my mammogram that I had at the age of 40, and 8 months later, 10 months later, after that mammogram, I find a lump. 9 months later, I find a lump. So I think that goes to show that there are other things you have to do besides just mammograms in order to prevent breast cancer, because you can go from being perfectly fine and 9 months later you have a lump, and mine was small. Mine was only 1.7 centimeters. So, we're not talking that big, but even though it was so small, it was still starting to get into my lymph node. And I can't imagine what would have happened if I had never stepped into the bathroom that day and took the time to do that self-breast exam, how long it would have gone before I actually would have found it. And interestingly enough, I look back on that, and I said I had no symptoms up until the time, or maybe I didn't, but I had no symptoms up until that time that I found it, or so I thought, until I had that pain that I was telling you about, that achiness. After knowing a little bit more about breast cancer and retrospectively looking back, I actually itched right there, and I didn't know it. And I found myself a lot doing this during the course of the day, occasionally. And as I read some of the side effects, itching is one of them. But I never put two and two together. So, questions? That's my story.
Thank you so much for sharing.
Oh, you're welcome. You're welcome. And my objective is, with my story, if I can encourage women to do self-breast exams, do the mammograms, get the early detection, then maybe if you are ever faced with cancer, maybe your experience doesn't have to be as difficult, because if you detect it early, there's so much more of a better chance of survival than detecting it late. And mine was stage 2. I was stage 2. That's what they actually staged it out. stage 2, so, because of the 1 micrometastasis to the 1 lymph node. If I hadn't had that, I could have been a stage 1. So, early detection, that is the key, and that's what saves lives, is early detection, and I'm a firm believer, because who knows where I would be if it hadn't been early for me. So, any other questions or anything I can